Well, hello everyone. I'm Michel, and I'm delighted to be able to talk to you tonight and today for this new webinar. And thank you for taking the time to join. In this session, Beatrice Zatorska, CEO and founder of the PD Body app, will be interviewing doctors Mark Weatherall and Simon Erridge from Curaleaf UK on medical cannabis and Parkinson's. Mark, who hopefully will be joining us shortly, is a consultant neurologist, and Simon is head of research. PD Body, for those of you who are not familiar with it, is our partner today, and it's a free app for people with Parkinson's and their caregivers. In my view, it is the most comprehensive one available out there. It helps you organize your daily routine, manage your symptoms, stay informed with a comprehensive daily news recap, along with features like pill reminders and symptom trackers. Curaleaf is one of the largest and most influential companies in the regulated cannabis industry. So before we begin, a quick note. Medical cannabis is regulated very differently around the world. What is allowed and how it is prescribed varies widely. So nothing we discuss today should be taken as medical or legal advice, and I encourage strongly everyone to check the rules in their own country, in your own country, state or region. There will be time for questions at the end of the interview, and you can use the Q&A function at the bottom of your screen. And for those joining us for the first time, the mission of No Silver Bullet is to share Parkinson's expertise and help our community make informed choices. So all our webinars are available on YouTube and Spotify and other podcast platforms. And the links are in the chat and on our website. So you can either look up the chat at the bottom of your screen, or you can go to our website, which is nosilverbullet4pd.com, nosilverbullet4pd.com. But let's get started. Please join me in welcoming Beatrice, Mark, and Simon.
Thank you, Michel, for the introduction. Indeed, for the past few months, I have noticed on PD Body a lot of chatter about medical cannabis. And some people said, oh, it helped me with insomnia. Somebody else said, oh, helped me with pain. But then more questions started rolling and more confusion came up from it because people start asking each other, oh, how do you take it? Where do you take it? How much? And where do you buy it? And then I had a conversation with someone who said, well, I have been taking CBDs for months and nothing happened. So I asked him, where did you buy it? And he said, from a corner shop. So at that point, I thought, this is it. We need to have experts and ask those questions. So today I'm really happy. We have two experts from Curaleaf Clinic and who will answer all those questions and clarify all those misunderstandings. Simon, if I can start with you, could you please introduce yourself? Tell us, what do you do at Curaleaf, and how come you start working with medical cannabis?
Yeah, of course. Thank you, Beatrice. Thank you, Michelle, for inviting me to speak today. My name is Simon. I'm a medical doctor by background, but as you said, I'm the research director or lead of research at Curaleaf. And how I really became involved in medical cannabis is through initially my research role at Imperial College London. When the law changed around medical cannabis in the UK on the 1st of November 2018, that not only made it legal for medical cannabis to be prescribed in the UK, but also opened up research. And so I really became involved in some of my already pre-existing research interests around inflammation and chronic pain, and sort of how could we study the effects of medical cannabis in these conditions. And that sort of very quickly evolved in 2019, when although the law had changed, it became very clear and obvious that there was going to be no mechanism by which people would be able to access medical cannabis in the UK through the national health system. And that's the sort of large single payer medical system for those of you outside of the UK. And it was at that time that myself, some others, including Mark at that time, set up what was then Sapphire Clinics, which has then gone on and evolved to become part of Curaleaf International, is now Curaleaf Clinic today. And so now my role, this is now a very long-winded introduction, revolves around really studying the outcomes of patients who come through the clinic using the UK Medical Cannabis Registry. So that includes a vast number of conditions, one of which is obviously Parkinson's. And very happy to speak to you all today a bit more about that.
Okay, great. So we have one of the co-founders as well, not just the head of research. And Mark, could I ask you also to please introduce yourself? Thank you for joining us tonight, and tell us, what do you do at Curaleaf, and how come you are interested in medical cannabis?
Hi, Beatrice. Yeah, so thank you so much for asking me to join, and apologies for being a minute or two tardy. So yeah, I'm a neurologist. I've been a general neurologist through all my career, with particular interest in in headache. But I've been I'd say a general neurologist for about 25 years now. And I was invited originally to join by Mike Sodergren, the clinician who kind of sort of led a lot of the original drive to create Sapphire, and they were obviously keen to have a neurologist involved, because one of the areas that even back in 2018, 2019, we knew was very important in medicinal cannabis was neurological disorders. So I've been working with Sapphire as was, and Curaleaf as we are now, since the very beginning, seeing all across the board of patients with neurological disorders, including Parkinson's. I mean, I joined really out of curiosity. I was aware that a lot of my patients in a lot of different disease areas were using cannabis that they were procuring for themselves and finding it helpful for a number of reasons. And I was really fascinated to discover more about this in a controlled environment. And it's been an amazing journey with Sapphire and Curaleaf. And yeah, really excited to be here, and keen to share what we've learned so far about the potential role of medicinal cannabis in Parkinson's and related disorders.
Fantastic. Thank you so much, Mark. I have a first few questions to Simon, if that's okay. I think the very first questions we need to establish the definitions. What is the difference between medical cannabis and recreational cannabis? I think there's a lot of confusion about that.
Yeah, thank you for that question, and I guess that is a difficult question to answer for all jurisdictions across the world. I'll start with predominantly Europe, because it's much more homogenous there, and similarly similar states in terms of in Australia as well, and other parts of the Western world, excluding the United States. So in the majority of countries across Europe, medical cannabis is the only form that is legal. There are a few exceptions to that, Germany being a notable one. And really what this pertains to in terms of the key differences between them is that, one, with medical cannabis, it has to be produced to certain standards, the same that you would expect from any other medication, to make sure that you are getting what you are intending to get, and that product that you're getting is free from potentially harmful contaminants. Medical cannabis is a natural product. It is grown in the ground, and that means that there's a potential for contamination from bacteria, mold, and other nasty things. But we also know that cannabis is what's known as a bioaccumulator. So things such as pesticides and heavy metals, if they are present in the soil, they actually tend to accumulate up in the plant and into the flower itself. And so that's why it's really important. We know that a number of people self-medicate for their conditions with illicit cannabis or cannabis that they have sourced from other sources. And that's one of the key distinctions, really, is that you know exactly what it is, and you know that it's going to be produced to those important pharmaceutical standards.
And under what conditions medical cannabis are available in the UK? Who is allowed to prescribe it? How patients have access to it? Through NHS prescriptions, or private clinics, or referrals? Could you clarify that?
Yeah, of course. So unfortunately, the UK medical cannabis is only available for a small proportion of individuals and for a small proportion of conditions. These are people with multiple sclerosis associated spasticity who are eligible for the licensed product Sativex or nabiximols. That includes individuals with treatment-resistant epilepsy associated with Lennox-Gastaut and Dravet syndromes, as well as tuberous sclerosis complex, and they'd be eligible for Epidiolex. And then thirdly, nabilone for chemotherapy-induced nausea and vomiting. Beyond those, individuals are largely going to have to be able to access medical cannabis through private clinics, such as Curaleaf.
Okay, so what are the barriers exist in access?
So to be able to be eligible for medical cannabis, so for instance, someone with Parkinson's, they would need to have tried and failed to gain sufficient benefit from licensed therapies for their symptoms. And that may be their motor symptoms, but it may also obviously importantly be their non-motor symptoms, things such as chronic pain, poor sleep, psychiatric comorbidities, etc. And that's actually where in the context of Parkinson's, more of the evidence lies around its potential effects.
Okay. And what are the current clinical evidence and trials that actually medical cannabis are helping people with Parkinson's?
Yeah, the unfortunate thing is because of the many years of prohibition that we've had around cannabis in the UK leading up to 2018, Australia 2016, Canada 2001, that meant that there was a huge restrictions also on the ability to conduct research clinical trials. So that means that ultimately, actually, that highest level of evidence that would unlock NHS access in the UK or in insurance covered medical cannabis access in other parts of the world simply hasn't been forthcoming. There are a few trials that have been conducted. They tend to be small, very select cohorts, and they tend to be largely focusing on using those licensed medications, but in an off-license format. So we don't necessarily know that they are the most appropriate formats of medical cannabis for those patients. But what we have been shown is that in some instances, there have been some improvement in motor symptoms. In other trials, there have not been. In some, there have been improvements in quality of life. In others, there have not been. But really, more of the evidence has been generated in terms of observational studies, and largely they have been showing changes in health-related quality of life or sleep outcomes as the predominant effect.
Okay. Mark, if I can ask you some of the questions from your experience working with people with Parkinson's and how they react to medical cannabis, what are the most symptoms promising to treat people with Parkinson?
Yeah, so it's been a really interesting thing to be involved with treating people with Parkinson's with medicinal cannabis. And I think let me start off by telling you about the very first patient that I saw with Sapphire, as it was, and this was very early on. This was actually just before the COVID lockdown in the UK, so it was early 2020, and this was a man with moderately advanced Parkinson's and quite significant motor symptoms. Some, sort of motor complications starting to develop. But his main problem was that he could not sleep. He spent most of the night in an off state, was very uncomfortable, very painful. And the standard kind of ways of trying to manage that, slow release, dopaminergic treatment, dopamine agonists, the whole things that you would expect and you all know about had been tried and nothing had really helped. And we started off treating him very, very cautiously indeed, because this was unknown territory for us. But we gave him a very small dose of a medicinal cannabis oil, a whole plant extract with tiny bit of THC in it, in addition to all the other kind of moieties in the cannabis plant, and told him to be really, really cautious and to start with the very tiniest of doses in the evening and just build it up. And he came back 4 weeks later, absolutely thrilled, because he had got the best night's sleep that he had had for years. And that had had an enormously positive knock-on effect on his whole functioning throughout the whole 24-hour period. And I think it was a really important early lesson for me, that whilst even back then there were one or two very small trials that suggested that there might be some benefit in Parkinson-related dyskinesia and dystonia, and it was pretty clear that there was no evidence of disease modification or anything like that. Actually, it was the non-motor symptoms of Parkinson's that were going to be the ones that we really would be able to make big inroads into. And of course, what I guess I've learned looking after neurology patients more generally over the last 5 or 6 years is that there's all sorts of things that go along with living with a chronic neurological condition like Parkinson's. So many people with these conditions have problems with sleep, with pain, with anxiety, and these feed back into all the other problems that come. So all the motor side that we kind of concentrate on in sort of standard, clinics, is all hugely influenced in a way that is you cannot get away from by all the other stuff that goes on, and obviously all the non-motor symptoms. So that was that. It was an amazing first experience, and it really sort of showed me what the benefit could be. I think over time, as we've sort of seen more and more people, I think the benefit for sleep, I think, is something that we see very, very consistently. And in the data that we kind of ask our patients to provide for us, their kind of outcome measures, we see these improvements across the board in pretty much every condition we treat, including the Parkinson's patients. It's incredibly valuable, or it can be incredibly valuable for pain, and it will allow people in some cases to stop using, for example, opiate medications, which of course are unhelpful because of the constipation that they cause, which is already part of their condition, and so on. So I think it is the non-motor symptoms, as Simon said, where there is good evidence accumulating of benefit. But I think in Parkinson's, I think probably more so than in any other condition that I see, the impact of that is actually, then often has a very beneficial effect on the control of motor symptoms, even though it may not be so much the direct impact of medicinal cannabis. Although even that, I think in some cases we do see as well.
Thank you. I think, Michelle, you had a very good example how after, I think, 8 months struggling with insomnia, trying medical cannabis, it helped you.
Yes. It was at the start of last year that I started suffering from insomnia. It really appeared, I wouldn't say overnight, but over a short period of time. And the problem with that is that melatonin, which worked at the start for me, was working less and less. I looked at sleeping pills, and of course, some of them contain basically ingredients that will not help your Parkinson's, that will make your symptoms worse. And some of them that work pretty well, actually you can't take forever because they would create addiction. So I was a tiny bit lost, if you want, and I tried CBD and THC, incidentally from Curaleaf. And for the last year and a half, my sleep has improved tremendously. Now, in all transparency, I'm also combining the THC with controlled release levodopa that I take before going to bed and once during the night. And I now sleep 6 to 7 hours every night, so which is for me enough to function. But the 3 hours I was on before were really debilitating, and it was preventing me from function to exercise. And we know how important exercise is. When you are really waking up after 2 hours, 3 hours sleep, you don't exercise as well as you would normally. And mentally, it just makes you slower, and it sort of like impacts you overall. And very quickly, I wouldn't call it depression, but your morale goes down as well. So it's a bit of a chain reaction that makes everything worse. So in my case, as I said earlier, I'm a sample of one, but in my case, it was extremely helpful.
And I think, if I may say, I think there's a really important point there that you make, Michelle. That what we're doing, what we're providing, sits alongside standard therapies for Parkinson's. There is no intention for people, to replace, standard, licensed therapies here. what we're doing is we're providing adjuvant treatment, and it, you know, it may be helpful, you know, synergistically with medication that people have already, but it may also help in areas where standard medication options may not be so effective. And as I say, in some cases, it may allow people not to take medications that might otherwise be deleterious in one way or the other.
Interesting. Mark, in your view, what mechanisms or biological pathways might allow cannabis to help with Parkinson's?
So I think this is one of the, I mean, this is an area where, you know, we know very little, and probably what we do know indicates that we know even less than we thought we might know. You know, the endocannabinoid system is hugely widely distributed throughout the brain and the human body, and we're only just starting to scratch the surface of the multiple effects that it has. So I think this is really one of those areas where I think we're all kind of have to say, you know, watch this space. I think, you know, our understanding of where the endocannabinoid system may sit in terms of, you know, pain processing, I think is starting to come through. We understand, you know, we know quite a lot about that now. Certainly in terms of, you know, generally, you know, the effect on, you know, the reticular activating system and sleep. I think this is an area of quite active interest in research, and of course it's one of the most broadly researched areas in cannabis research over the last 20 or 30 years. I think in terms of, you know, the potential impact that modulation of the endocannabinoid system might have on the motor circuitry in Parkinson's, I think this is an area that we actually know almost nothing about at the moment. So I think, you know, the bulk of the information we have still, as Simon alluded to at the beginning, comes from observational studies of the use of medicinal cannabis or other products in people with these conditions. I think what we're generating is, by those observational studies, is a series of interesting hypotheses and questions that I think we would like, you know, people to then go back and explore in more detail and try and start to really unpick the basic science of this.
Okay. Another confusion across our members on PD Buddy was about the formulation of medical cannabis and how they should be taking. Is it they should inhale, or they are oils, or inject? There was a lot of questions about it. And also, is there a particular way for people with Parkinson's?
So in general, when we prescribe medicinal cannabis, certainly in the UK, and I think it's pretty much true across the board, there are two or three fundamental formulations that are used. So obviously, when people think about cannabis, they think about people smoking cannabis. People do not or should not be smoking medicinal cannabis. So if they want to inhale, then the advice, and certainly in the UK, the law requires people to vaporize cannabis using a dry herb vaporizer. So basically heating up cannabis on a hot plate, vaporizing it. And that actually releases a higher concentration of the active metabolites within the cannabis plant than if you burn it, if you combust it, as would happen when people smoke it. And obviously it stops people kind of cutting it with tobacco and doing otherwise unhelpful and unhealthy things. The other main formulation is cannabis oils. The oils are whole plant extracts. So unlike what you could go into, say, a pharmacy in the UK and buy over the counter, which should just have CBD in it, these have everything that's in the cannabis plant. And obviously the pharmaceutical grade oils will have specific concentrations of THC and CBD in them. The oils are taken by putting them under your tongue and holding them there. And what you're looking for is a direct absorption through the oral mucosa. So if you can hold the oil there for about a minute, then all of it, virtually all of it, will get absorbed into the system. And again, that's a very effective way. Now, obviously, a third option, which is becoming quite popular in the UK, is the use of pastils, which people will suck and they dissolve. And again, you get a little bit of oral absorption, but a lot of that then is absorbed through the gut. that's not so much of a problem, except that you lose quite a bit of the active ingredients as it's absorbed and goes through the liver, first pass metabolism. The main difference is the sort of speed of onset and the duration of onset. So when you vape, you get a rapid uptake and quite a rapid effect, but it will wear off much more quickly. Whereas if you use the oils, it takes about maybe 30 to 40 minutes for them to build up to a peak in your system, but they will last for longer. So to a certain extent, which formulations one uses is a matter of preference. So some people are used to smoking or vaping and they're happy to continue doing that. If people aren't smokers or vapors, then they will usually not want to start. And so very often people will use oils. Obviously, for people with Parkinson's, there are issues around, dexterity and the ability to utilize the equipment to vape, the ability to, draw up small quantities of the oils and to hold them under the tongue. People with orofacial dyskinesia, for example, find this quite difficult. And so obviously in those cases, the pastils are often easier options. So as I say, that there are different options, and some people will use a combination. They will use oils or pastils to try and get a kind of a general level of control, and then they may vape for kind of breakthrough symptoms. So there are no right or wrongs. I mean, medicinal cannabis is kind of personalized medicine in a way that it maybe is a little bit different from standard treatments and formulations. Although in some ways it sort of reminds me a little bit of the way that people use levodopa. That there are kind of there is a kind of standard. Okay, well, you're going to take levodopa 3 or 4 times a day. You might have a modified release. But actually, people end up often finding their own regimes and finding what works for them. And medicinal cannabis very similar in that sense.
And
Beatrice, I'm sorry, I just going to interrupt. I see some people putting questions on the Q&A part of the Zoom screen at the bottom. Please copy them into your chat, because I will basically going through the questions when we finish with the interview. I will be looking at all the questions in the chat, but I won't be able to toggle between Q&A and chat. So please, if you put questions in Q&A, copy them and put them in chat. Sorry. If you put questions in chat, please put them in the Q&A. That is where we're going to take the questions from. Put them in the Q&A. Sorry for confusion.
It's just a follow-up question, because it's other question pop out from people. Is it CBD and THC, or does it have to be together, or can be only CBD or only THC?
So, I mean, again, it depends a little bit on the effect one is looking for. But if one is looking for effects in sleep promotion, pain reduction, reduction of anxiety, most of the things that people will look to use medicinal cannabis for, then it's pretty clear that the extracts of the whole plant will work much better than pure extracts, particularly of CBD alone. I think there are 2 sort of aspects to that. Firstly, I mean, obviously THC in and of itself has more of an effect in those areas. It is, of course, the more psychoactive moiety within cannabis, but what we're looking for in medicinal cannabis is not to make people feel high. It's not to make people feel stoned. It's to have that calming, relaxing, sleep promoting effect. And part of the way that we kind of achieve that using medicinal cannabis is by, controlling, the dose that you're taking, which obviously is very difficult for people that are procuring, street cannabis. You just don't know what you're getting. So it's possible for people to very cautiously start with small doses and then to build it up to a level that works for them, to find that sweet spot where they get a beneficial effect without significant side effects. So that's the first thing. The second thing is that one of the issues with, again, the differences between, say, street cannabis and medicinal cannabis is that street cannabis is generally bred to be extremely high in THC because that's what people want. Whereas what we're looking for is much more of a balance in the major components of the plant. So the presence of CBD ameliorates some of the side effects of THC. So it's the balance that's almost much as important as the actual doses. So whole plant extracts in terms of the oils are generally more effective for most of the things that people will use medicinal cannabis than either pure isolates of CBD or THC or just CBD alone.
Well, that explains. Thank you. And in terms of side effects or risks for people taking medical cannabis and people with Parkinson's, we had a chat with Michelle earlier, so, and I know that during the night where he feels a little bit woozy, he mentioned to me several times, and we thought about what about older people. If they are, for example, getting to the toilet, they must fail or something. That was one of our concerns. But have you, with your patients, experienced, heard about any other risks and side effects?
So obviously that's it's a really important question, and like any other medication, there are no medications that do not have potential side effects, and it's really important when people are thinking about using medicinal cannabis that they understand what those effects might be. Now, obviously, then on the other side, I would say that actually, significant serious side effects are extremely rare in medicinal cannabis when it is provided through reputable registered clinics. So I mean, the evidence that we have, for example, from the register that we run at Curaleaf, shows a proportion of people experiencing side effects, but the number of people with serious side effects is really very small, and that's borne up in literature from Canada, from the States, from other European centres. So from that point of view, that's very reassuring. Obviously, one of the big concerns about cannabis is, well, can it actually adversely affect people's mental health? Can it cause psychosis? And again, this is incredibly unusual in people who are prescribed medicinal cannabis for conditions, for neurological conditions. And again, the reason for that is because of the control that one has on dosing, the balance of the products that between the amount of THC and CBD in them. So from that point of view, those sort of effects are fortunately extremely unusual. The commonest side effects from medicinal cannabis are a sort of drowsiness or wooziness and sort of GI symptoms like nausea. Probably, I mean, Simon can kind of nod in the background here. I mean, my experience is maybe about sort of 10 to 15, 20% of people will experience some level of side effect. But again, it's often possible to kind of minimize that by just careful dosing and thinking about the way that it's used. And so, for example, I will always tell people, particularly if they're cannabis naive, to start off using it in the evening, get a sense of how they feel before they then start using it other times during the day. And again, for people who maybe are a little bit older, it's the same rule as one applies to all medication, which is, start low and go slow. We advise people to use really the very tiniest doses initially, and then just to slowly and steadily build it up. And again, what you're looking for is that sweet spot where the impact is meaningful without the side effects being limiting.
And from your experience working with your patients over the years, what have you noticed the improvement of life, the clinical quality of life? We talk about certain symptoms improvements like insomnia or pain, but in general, what have you noticed in your patients? And also, is there any a type of people who benefit from medical cannabis in particular?
So, I mean, I think, look, yeah, I mean, the general feedback from, a very significant proportion of the patients that I've looked after with Parkinson's has been that they found it, has made a significant difference to their quality of life. I think it's quite interesting. I think there are probably a couple of reasons for this. I think it is one of these things that when people try it, usually reasonably quickly get a kind of sense of whether it's going to be helpful. And I think people kind of, if it works for them, they'll carry on quite, they'll quite quickly come to a decision that yes, it's helping, and they'll carry on. And some people quite quickly come to a decision, no, it's just not for me. And I think that's partly, the speed of that's partly because of still that slight sort of stigma around, oh, it's cannabis, and should we be using it or not? And then the second thing, I mean, obviously in the UK, it's a private prescription, people are paying for it, and that obviously often sort of concentrates the mind of, is this really worth doing? So I think people, reasonably quickly will come to a sense of whether it's helping. And from that point of view, where it does help, I think people often quite quickly will experience quite a significant improvement. I mean, obviously that first case, not everybody came back, within 3 or 4 weeks, sort of, absolutely thrilled and delighted like that first patient. But many people do, and I think what we also see, and I think Michelle's experience, I think probably bears this out, is that where it is helpful, I think the effects tend to be quite persistent, whilst there is sometimes a degree of tolerance, actually people often find that once they get onto a kind of dose that suits them, it will often work well for them over an extended period of time.
I can confirm that. Well, actually, it's only been a year and a half, but over a year and a half, I have really had stable improvement to my sleep, and I'm not planning on stopping using THC and CBD at all. Maybe to reinforce the point that Beatrice was making, I haven't had any side effects whatsoever. But when you wake up around 3 or 4 o'clock in the morning and you go to the loo, and I'm 60 years old, I'm mobile, the bathroom is like 5 meters from my bed. I do sometimes feel a bit like I'm on a boat, if you want, and I'm thinking, if I was 80 years old, 85 years old, if I had balance problems, if I had to go through a staircase, that's the only time when I would really be expressing a word of caution. This is not the side effect, this is the effect of it. But I just would like people who listen to this presentation today to be aware of this. This is the only word of caution I would have, because for the rest, it has been entirely helpful to me.
Yeah, I mean, there's very few absolute contraindications to the use of medicinal cannabis. I think, people have got sort of significant, ischemic heart disease. We would be cautious. Obviously, women who may want to get pregnant or breastfeed, we don't advise the use of medicinal cannabis in that patient population. I think in terms of relative cautions, the two that are most relevant to people with Parkinson's is, we are cautious in people who are at risk of falling, which obviously is something that is very much part of the problems that can come with this condition, and also people with a propensity to kind of low blood pressure. Again, not an uncommon problem in people with Parkinson's, particularly more advanced Parkinson's. But these, as I say, these are not absolute contraindications, but again, it brings us back to the caution that we take. And again, to come back to make the point that one of the kind of things about a medicinal use of this is that one can control these things much more carefully and than one could do with anything that's bought in any other way.
Mark, thank you so much for sharing your experience and giving us the insight how you're working with your patients. Simon, back to you. If I can have a couple of my questions to you. Given what we said today, especially at the beginning of our conversation, looking ahead, what are the biggest research gaps and challenges we have on next steps to make medical cannabis to be used, helping people with Parkinson's, and if there are any plans for Curaleaf Clinic to take part in this next steps?
Yeah, of course. I think with medical cannabis, we have the exciting opportunity to take a multi-pronged approach to our research. I mean, in very few instances would you have a medication that isn't widely available on the NHS, which hasn't gone through a series of randomized controlled trials. But so I think one of the key things is continuing to build the observational evidence around this, and also trying to marry that where possible with some of the preclinical evidence, the studies that are being conducted in laboratories in terms of Petri dishes, but also importantly animal models, to see if we can really truly identify what are the optimal cannabis-based medicines for individuals, in this context, Parkinson's, but also the wide range of other conditions that we see. And really that should form the basis of future work in terms of randomized controlled trials. I know that there is a lot of conflict and debate about the necessity of randomized controlled trials, particularly amongst the medical cannabis patient community. But what I would say is that for the end goal, which I think we all want, which is if medical cannabis is a truly effective medication on a population basis to change attitudes to open up access via the NHS in the UK or other healthcare systems, ultimately it is going to be randomized controlled trials that will do that. And the development of more licensed medical cannabis products, that is something that it is hopefully on the horizon for us. Obviously, we are working across preclinical research, clinical research, but obviously it's all fingers crossed, toes crossed that research is promising enough to then take forward into those trials. So I guess it's a case of just watch this space, but I think that's ultimately where everyone in the industry should be heading towards.
Okay, and very important question, practical. What are the costs currently of using, for people with Parkinson's, using medical cannabis if they want to drink, and if they start now, and what is the how is this sustainable and affordable if they want to take medical cannabis in the long term?
Yes, of course. I mean, I can obviously only predominantly speak from UK experience, but in terms of the cost of accessing via a clinic, for instance, with Curaleaf, you can either pay £50 for across the entire year, £30 per appointment, or £5 per month. So there's an ability to either spread the cost or pay upfront, whatever is most appropriate for you. In terms of the costs of the medications, it can vary quite across a large range depending on what you're prescribed in terms of the formulation. So whether it's an oil or a flower or some of the other formulations that Mark mentioned, and in terms of the overall dose, obviously if you need a lower dose, that's going to come with a lower cost versus someone who needs a higher dose of medication. And really that can range from the tens of pounds, £35 upwards per month, to those people who are needing more and more into the low hundreds per month. So it's really going to be a case of, it's going to be difficult to say upfront from a first consultation, you are going to be someone who's going to be paying very little, or you're going to be someone who's been paying very much. So unfortunately, I can't give much more guidance beyond that. But certainly, if it's something that you are interested in exploring, we can at least try and keep the cost of consultations down for individuals, as well as making sure that they understand that they may be eligible before proceeding to an appointment as well, with a free eligibility checker.
Okay, and so if somebody listens to our conversation right now and thinking, okay, well, I'm ready to go give a go. What do they do? Where do they go? And how do they know that they are eligible for it?
Exactly. So just to recap the eligibility criteria for those who maybe joined us a little later, or we've talked a lot, so maybe forgotten, is that to be eligible for medical cannabis in the UK, you need to obviously have a diagnosed condition where it might be suitable for, and then have tried licensed therapies for that. So in the context of Parkinson's, obviously people may be most commonly thinking of dopaminergic treatments for motor symptoms, but of course that may also include sleep medications, so things such as Zopiclone or promethazine for sleep, and pain medications, for example. If you have a diagnosed condition and you have tried those previous medications, then you would meet the baseline criteria to be eligible. But then, so what you could then do is head to curaleafclinic.com and fill out a quick eligibility form and provide your GP records, or your summary care records as they're commonly known. And our team can go through those and give you an idea whether it's appropriate for you to proceed to that first appointment, to see if you meet those basic criteria. But obviously it's really important that you see a specialist like Mark or one of our other neurologists to not only understand, are you eligible, but are you a suitable candidate? Is there a reason why medical cannabis shouldn't be prescribed for you? Or is there another medication that is most appropriate for your symptoms to try first? So that's the kind of process that you would go through. Then after you've seen a specialist like Mark, he would take your case to what we call a multidisciplinary team meeting, an MDT, which happens at least once a week, and Mark, alongside other specialists in other fields of medicine, such as psychiatry or pain medicine, will discuss your case and decide, yes, are you eligible? 2, are you suitable? And 3, if so, what is the most appropriate medication for you on an individual basis?
If I may just butt in for a second, just to say that as far as I'm concerned, when I basically contacted Curaleaf for the first time, I just had, I understand it's a bit UK-centric, but I had to download my patient file from the NHS app. And that mentioned that I had suffered from Parkinson's for several years. It mentioned that I had sleep problems, that I had no medication helping me. And I basically sent it to Curaleaf, and they came back to me within a few days with approval. So the process you highlighted actually is, of course, entirely correct, Simon, but for the customer, the patient, so to speak, we don't see it. It's very seamless and very easy.
Yeah, and just to build on that, there are multiple options by which you can do that. One, as Michelle described, is getting your own records and sending them across to us. But if you, for some reason, don't feel comfortable doing that, or there are maybe digital limitations for you accessing them, then we can contact your GP on your behalf.
Thank you so much. In my very last question, before we go to Q&A, it's to both of you, Mark and Simon. If you imagine the future of Parkinson's care, what role do you hope medical cannabis will play?
Well, I'll start. I mean, I would like to see it. I mean, I'd like to see medicinal cannabis much more widely used. I mean, I have a lifelong interest, or not a career-long interest, shall I say, in the history of medicine. And with my historian's hat on, I note that it is a historical accident that we're not using cannabis and anyway, and because people were in the Victorian times and up to the 1930s, and it became widely prohibited for political reasons and have very little to do with its kind of utility and value as a potential medication. So I think what's happened in the last 15 or 20 years, initially in Europe and the States and Canada, and now more widely around the world, in terms of rolling back the kind of stigma about cannabis and trying to understand, really how useful it is, has been incredibly important. And I would like to see that carrying on. And I think within Parkinson's, again, one of the things that's really happened in my lifetime working in neurology has been, an increasing recognition. So it's a long day. Increasing recognition of the importance of non-motor symptoms in Parkinson's, and I think this is the area where medicinal cannabis will, has the most value. And I think I genuinely believe that it has utility in a lot of areas, which would make it, if it were available, very much a kind of first line option for a lot of the things that people struggle with as their Parkinson's disease advances. So that's what I'd like to see. It's not going to happen overnight. It's not going to happen quickly. And I think Simon's point about the importance in the longer term of, clinical trials that, will arise from the clinical questions that our observational studies provide is really important. It's going to be really important in allowing that process to happen and allowing wider access and more equitable access to medicinal cannabis.
Thank you.
Yeah, perfect. And then I guess to build on that a little bit is within the context of Parkinson's and many of the conditions that we see, there are of course a number of effective medications that people may derive benefit from, but we also know that there are a huge proportion of individuals who either simply don't respond to first-line therapies, or indeed they suffer side effects, obviously commonly in the context of Parkinson's, dyskinesias and other such symptoms. And so therefore, I think it's really important, and obviously we're taking the approach from a medical cannabis point of view, but is that the entire medical community should be constantly working to increase our armory, as it were, in order to be able to address symptoms. Like Mark mentioned, there's no evidence at present that medical cannabis is a disease modifying medication. Obviously, that's the one thing above all that we all hope for in the context of Parkinson's. But certainly until we get to that point, the development of more medications that can address symptoms, the better.
Right, thank you very much. Well, thank you very much. All questions from me. And Michelle, I can hand over to you. And I know that there's lots of questions from the audience already.
Thank you very much, Beatrice. Thank you, Simon and Mark. So I will go through the questions. Before I do that, if I could ask the people who put their questions in the chat to please cut and paste it to the Q&A. So I'm looking at the Q&A list. If your question is in the chat, I will not see it, unfortunately. So please move your questions to the Q&A so I can go through them. There are quite a few questions actually already. This is really quite interesting. So Rebecca is asking a question, I think, on a topic you covered already, but maybe just to retrace the main points. She basically says there are various formats of cannabis. Which is the best in Parkinson's when taking medical cannabis? I think this is the question about oil, smoking, etc.
Yeah.
You covered that already, but is there one that works better than the others, do you think?
I don't think there is one that works better than the other. I think the largest proportion of our patients with Parkinson's use oils. And I think the real value of that, I think, is the ability to really tightly control the dosing and to understand the absorption. So yeah, I think most of our patients use oils initially at least, and I think that's probably the most sensible initial choice.
Thank you, Mark. Yeah, that's what I'm doing too. Actually, it is quite straightforward. So I think that actually the next question actually is a question that comes back quite a lot. Many people are asking about REM behavioral disorder. So does it help for people who suffer from that condition?
I mean, we know quite a lot about the impact of the various sort of components of cannabis on sleep architecture, if you like. So we know, for example, that THC suppresses REM sleep. And so theoretically, at least, it may be that if you have a REM behavior disorder and you're suppressing REM sleep, that might be helpful. There's very little data on this. We've got a few patients that have come through who have Parkinson's and REM behavioral disorder, and some of those patients have reported improvement, but not all of them. There's a little bit of work on CBD, but the results are very mixed. So I think this is an area that's open for further research, definitely.
So Pilar is asking us, I think I probably know the answer to that. She's asking if there is any evidence that THC might help with tremors. I think you've been insisting on non-motor symptoms mainly.
No. So I mean, yeah. I mean, look, I mean, the answer to that question is, I mean, it depends a bit what you mean by evidence. If you're talking about, double-blind controlled, placebo-controlled clinical trials, then the answer to that question is no. If you're talking about, observational evidence and feedback from patients, then yes, and in a lot of cases, people do seem to find that medicinal cannabis is helpful for improving, motor symptoms as well as non-motor, and whether that is I'm genuinely agnostic about the question of whether that's a direct effect on that motor circuitry that goes awry in Parkinson's, or whether it's an indirect effect by improving people's general well-being and thereby having a knock-on effect on our brain's resilience in that scenario.
Thank you very much, Mark. Patty in the US, she's asking a question that you may or may not be able to answer, as I realize you both are from the UK side of Curaleaf. But she basically says that her US state, is not a choice on the website. Does it mean that the website only shows choices for those states that have approved the use of medical cannabis? I don't know if either of you is aware of that.
I can potentially answer that. So Curaleaf will only operate in not all of the states that have approved medical cannabis. So it may be that Curaleaf products are available in that state, but it may not be that there's a direct Curaleaf footprint. But hopefully a quick Wikipedia search can identify whether medical cannabis is legal in your state, and then how you may go about being able to access it. Obviously, it's different on a state-by-state basis in the US.
Of course. Thank you, Simon. Pilar has another question. I always have to ask one or two questions that I don't understand, so please be patient with me. She's asking if retrograde firing, I don't know if it's something like a human resource expression, no, probably not. Is retrograde firing a possible mechanism of action for cannabis?
Oh, Simon, I was hoping you were going to take that one.
I was just trying. Do you mind repeating that, Michelle? Sorry, it was.
Yes, she's asking if retrograde firing is a possible mechanism of action for cannabis.
Yes. So essentially the main receptors of the cannabinoids are in the central nervous system are CB1 receptors. And essentially the main way in which they work is they sit on the presynaptic terminal. And when they are activated by THC or our body's own cannabinoids, what they do is they essentially prevent the release of neurotransmitters. So retrograde firing, so our body's own cannabinoids are produced in the postsynaptic terminal. They get released back, and then they activate those CB1 receptors.
I see. Thank you, Simon. I'm happy you were there for that question. We have two questions actually arriving simultaneously on the same topic. Gary is asking, will you get the munchies? Now, the munchies, I've only consumed medical cannabis, but I know that people who buy street cannabis, to call it that way, sometimes get hungry or have their appetite boosted. And Greg is asking whether medicinal cannabis stimulate appetite in the way that street cannabis often does. So the same questions.
So it certainly has the potential to. Obviously, it depends on the dose administered. Really interestingly, we find that there's also different metabolic effects at play. So in terms of questions about weight gain as well, we actually see that conversely, individuals who are cannabis consumers tend to be of a lower weight, but I don't know whether that is largely driven by recreational use and whether there's any confounders in that. But there's certainly interesting effects on THC and CBD on metabolism, whether that's within fat cells themselves, which are THC and CBD are highly lipophilic, so they tend to accumulate within the fat, but also within the liver itself. So that, I guess that's sort of a future question to be answered in terms of weight. But certainly there is a potential for it to increase your appetite, but it tends to be not a commonly reported adverse event, but maybe people aren't recognizing it as adverse event. Maybe they want a slight increase in the appetite. Who knows?
Well, as far as I'm concerned, I haven't noticed anything on the contrary, and it's not related to cannabis, but actually my weight is an important thing that I need to follow up constantly to make sure I don't get too slim. But actually, I have not had the munchies, as someone was calling them. John is asking, what is the suggested dose in milligram for sleep? I don't know whether that can be answered to without seeing the patient, so to speak.
Yeah, I think it's always difficult. People often say, oh, what's the typical dose here? So I mean the simple answer to that question is there is no consistent dose, because obviously people's response to the medication is very different, and that the answer to that would depend very much on people's individual biochemistry and also previous exposure to cannabis as well. So I mean, I guess to give a context, most people, if they were cannabis naive, particularly older people, you would typically give people what's called a 10-10 oil, which has 10 milligrams per milliliter of THC and 10 milligrams per milliliter of CBD and a trace of all the other elements in the cannabis plant. And you would suggest that people started off with 1/10 of a milliliter or even half of that. So that would just be half or 1 milligram of THC, and build it up slowly. So the doses often, helpful doses often are in single figures milligrams of THC, for example.
Absolutely. Thank you, Mark. Tim is actually asking a question, or I would say slightly disagreeing with the fact that there is not enough peer-reviewed research into cannabis in medicine. He's talking about an organization called IACM, which has, according to him, a large number of studies. I don't know, would you know the cannabis.med.org bulletin website, if that rings a bell?
Yeah, I saw that question.
Yes.
I hope we didn't come across as saying that there aren't peer-reviewed studies of the effect of cannabis in a lot of areas within medicine, because there are. There aren't a huge number in Parkinson's, there aren't, but there is an awful lot within pain medicine and sleep and some of the psychiatric areas as well. So yeah, no, there is a lot of peer-reviewed research. There's relatively little in terms of double-blind, placebo-controlled, randomized clinical trials, but again, there are increasing numbers. In my
Yes.
area that I'm interested in, headache, for example, we've had two trials of that nature that have appeared in the last couple of years. So there is a lot of existing research, and there is an evidence base, but do we need more evidence? Yes, we do. And we need more that links in the basic science and the clinical science, definitely.
Thank you, Mark, for clarifying. Betty is basically saying that her husband has sleep issues, but mostly during waking hours, his constant anxiety. So it's basically, let's put the sleep aside for a second. I think her interest in medical cannabis is mainly that her husband suffers from constant anxiety during the daytime. And that's why she's interested in this. He's bedridden. And she's asking how should she look at medical cannabis in this context?
Well, I mean, obviously, anxiety is one of the indications that is recognised as a potential, potential utility for medicinal cannabis. So, obviously, anxiety, is hugely common in people with Parkinson. So, again, this would be an area that would certainly be appropriate to explore.
Someone is asking. Sorry to interrupt, Mark. Yes, you're saying anxiety is one of the main conditions that is basically where cannabis has been seen to be quite helpful. So,
yeah.
Does that mean that she should be looking at CBD only, or?
Well, again, that might be. That might be more of a kind of question to look at, in terms of, the patient's individual kind of,
yes.
The medical conditions they have and their general sort of, condition and well-being. So it's something that, again, there's evidence for, most of the main kind of active moieties within cannabis in terms of the effect that it can have on anxiety disorders.
I understand. So there is a question here that I can answer myself. It's quite straightforward, as you can imagine. Is medical cannabis legally available in the UK? Yes, it has been since 2018, I believe. Thank you very much. I wish all the answers were that simple. All the question was that simple. Actually, someone's asking about cognitive changes, especially in advanced PD. I don't know if that person means, does medical cannabis create cognitive changes, or does it help with cognitive changes? I don't know.
Yeah, I mean, I read that question as would it be something of concern? And I think, yeah, I mean, again, I think one would kind of treat this in a way that any drug that potentially could cause, drowsiness and sort of changes in people's kind of overall sensorium. So, in the same way that one would be cautious about many drugs in patients with advanced Parkinson's with dementia or Lewy body disorders. One would, again, I wouldn't regard those as an absolute contraindication. But again, like all other medications, one would want to be, very cautious in those people with those conditions.
In the same context of contraindication, Sylvie is asking about people with low blood pressure. I think you touched on that before.
Yeah.
You're saying
it's something to be aware of as a potential kind of caution in the use of medicinal cannabis.
So a question that I saw from at least two people is about cannabis and alcohol. Is the use of medical cannabis contraindicated if you're having wine or other liquor?
I'm happy to take that one. So it's not contraindicated, but obviously you have to be aware, just like any medication that has the potential to cause concentration impairment, that if you were to be prescribed medical cannabis and take your medical cannabis and also consume alcohol, the risks of either or both causing concentration impairment obviously significantly increase. So obvious advice around driving, operating heavy machinery, signing important legal documents applies.
Thank you very much, Simon. Suzanne is asking an interesting question here. Where is medical cannabis grown, produced, to make sure it is clean? I think mine comes from Spain, if I'm not mistaken. But,
yeah, so medical cannabis can be grown or produced obviously in any country where it is legal to do so. Obviously, there are some countries where the conditions are more optimal for the growth of plants, such as sunny Mediterranean countries, such as Portugal, as an example. But the key important things is that they have to meet the certified criteria. So that means that medical cannabis must be cultivated and manufactured in facilities that meet good manufacturing practices, which are the sort of gold standard measures by which any medication must be upheld to across the pharmaceutical industry.
Thank you very much, Alan. Just not a question, but a comment from Steve, who basically says he was diagnosed 5 years ago with mainly tremors. He has had sleep issues and pain. And a few months ago, he started vaping cannabis, which has helped greatly and interestingly also helped to still my tremor. So this is someone who has benefited from the sleep, from the pain, and from the tremor. And his tremor used to keep him awake, and now it stops after vaping, allows him to go to sleep. So thank you, Steve, for sharing your experience. That's very nice. Tim, you have a question for me. Tim, you have a question for me. I will answer to you by email afterwards. Javier is asking, is topical application, he means by that cream, effective in pain relief?
So in terms of topical preparations, they are typically quite difficult to absorb through the skin. That's cannabinoids, both CBD and THC. There are some formulations whereby it can be attached to another molecule, which makes it easier to dissolve through the skin. But ultimately, largely the main ways in which you administer medical cannabis would be via either vaporization, as Mark mentioned, or oils, which are held under the tongue.
Thank you very much. Simon, sorry, this is Simon, one of our auditors, asking a bit of a challenging question. He basically says, Parkinson's appear to be on the increase. Yes, that is perfectly right. An increase in cannabis usage may have preceded this by a few decades. Might there be a causal link? So could cannabis have had an impact in generating more Parkinson's?
I mean, I don't know enough about the epidemiology of either to be able to draw a causal. I mean, certainly no causal link has been proven. I think it would be very difficult to be able to demonstrate that just due to the typical ages in which people tend to consume cannabis more widely is at younger ages. Then you would have a lag of, 20, 30 years potentially before the main incidence of people developing Parkinson's. So yeah, I do not know.
No problem. I would. I think it is. I would say almost like a slightly unfair question, but an interesting angle though. Graham has recently had DBS, and he's asking whether that would impact whether he should take cannabis or not.
Yeah, I mean, it's not. I mean, there's no specific contraindication to it in patients with deep brain stimulation. I think we have one or two that I've seen who have had DBS. I think one of them it had not been affected. The other one had it ongoing. So no, I don't think there's any reason why not. Can't think of any reason, Simon.
No, nothing from me.
Thank you both. Marcia is asking, what is the ratio between CBD and THC that would be generally the most effective in PD? And do you see differences between sativa and indica strains, which she assumes are used in medical cannabis?
I mean, again, I mean, I wouldn't say there's a specific ratio that's helpful. And again, it depends a little bit on the individual person and what sort of things you're looking to kind of try and help with medicinal cannabis. With regard to sativa and indica strains, I mean, it is said that in general, indica strains are kind of more calming and relaxing, and sativa strains may be more kind of, energizing and elevating. However, we've all seen patients in whom the opposite seems to be the case, and so I think they're very broad brush sort of sense of how the different strains might affect people. And again, the process of trying to find the right medicinal cannabis product for people sometimes requires a kind of iterative kind of process of feedback and trying to work your way towards what will work best for people. So yeah, in general, people will find indica strains sort of calming and relaxing, and that's what they're looking for.
Yeah.
So Simon, go ahead.
No, I was just going to build on that and say, like Mark was saying, the diversity within the indica and sativa strains is almost as much as the diversity between them. And obviously the things that are driving those potential effects is obviously the concentration of the major cannabinoids such as CBD and THC, but also potentially the terpenes as well. And so therefore actually rather than going from a binary indica or sativa, actually digging down into the potential terpenes. So something like linalool, which is from the lavender, commonly associated with the smell of lavender, potentially sedating effects. I mean, these are all things that need to be worked out in the long term in terms of exactly how the combinations of different terpenes and the major cannabinoids affect people, but certainly they would be good places to start.
So Mike in Boston is asking me an interesting question. He says, just like Michel, like me, he's a 7-year Parkinson's patient in the US with significant sleep issues. And to date, the only people who have given him a sample to try of CBD THC is his mother-in-law and his next door neighbor. So neither of which have PV. So his question is, sampling the product seems to be important. So can anything more be done to make it easier to try? So it seems to be that actually the system in the UK is quite robust. It doesn't open the door to just anyone. You have to demonstrate you have Parkinson's. You have to demonstrate that actually you have some conditions that are not held by the other medicines you're taking. But I wasn't able to sample. You either get the green light or you don't. Is there any thinking behind allowing people to, under regulated conditions, to try and see if it helps them?
I think if you were to adopt this to any other medication, you may start to think about why that might not necessarily be the most appropriate idea, whether, try this blood pressure medication, try this pain medication, try this X, Y, or Z medication. And you can start to see how, the whole medical system starts to unravel quite quickly. But we do see a number of people who have been self-medicating for a number of years. And then, it's particularly important for those individuals who have, shown benefit from their previous illicit use to be able to transfer across into, legitimate legal medical use to avoid some of those nasty things that can contaminate cannabis, of course. But yes, I think the most appropriate way to try is to do so in a controlled clinical environment overseen by, a healthcare professional rather than, trying outside of those settings.
So we surely are not recommending to anyone to try outside of the medical environment. But if people have tried and found it useful, they might want to mention it to their doctor as an additional reason why they should be given access to the medical form. Exactly. So Catherine is raising an interesting point here. I'm a big fan of mushrooms personally and how they can potentially help us as well as medical cannabis. And she's asking about psilocybin mushrooms, particularly microdosing them. What about utilizing both the mushrooms and the cannabis together? So I don't know if either of you has looked into psilocybin, which is hallucination, magic mushrooms in a sense, that some people have tried to develop an angle that they might be useful to our condition, although it is a much more dangerous environment than the one we're talking about.
Yeah, I have no experience with the use of psilocybin in any neurological disorder.
Thank you.
Similarly, and I think also in terms of the ability to access psilocybin versus medical cannabis is very different. It's generally not available outside of clinical trials in the UK, and so importantly, it probably is unlikely to be something that is accessible until those trials have concluded, and those trials are within psychiatric conditions, not neurological ones for the moment, at least.
Someone was asking, actually, so I'm just confirmed, turning to the question, oh yeah, here it is. Can patients from outside the UK consult in your clinic in the UK, or on site or through online?
But for two important reasons, no. Unfortunately not, I'm afraid. So that sounded a bit blunt, which I didn't mean it to be. First, it's really important that we're able to converse with your usual healthcare provider, typically a GP, in terms of being able to access your records and be able to, importantly, provide them with the information that we have prescribed you medical cannabis. This is what you have been prescribed, so that they, as the ultimate gatekeepers of your entire medical care, can be informed about other medications that they may wish to prescribe you in the future. But also, secondly, just in terms of import and export of of those licensed medications across borders would be functionally very, very difficult to do.
Thank you, Simon. Gary is asking about a question we covered already. Would CBD or THC be helpful for people to control their tremors? Now, we had a live testimony from someone who had good experiences with that. I don't know, Mark, if you want to maybe go through this again and perhaps highlight the fact that is CBD or THC more likely to help with tremors, or is it a combination of both? Sorry, Simon, maybe I don't know which one of you want to pick it up.
No, happy for Mark to go.
Yeah, I think there's very little evidence that CBD alone has much effect in motor symptoms in Parkinson's. I think that there's very little that suggests that it does. So I think if one was going to kind of look at the potential benefit of Parkinson's for tremor, then one would certainly want to be looking at a formulation that has THC in it, and again, for all the reasons that we sort of discussed earlier on, that balanced formulations, sort of whole plant extract oils or balanced flower would be the most appropriate choices, I think.
Thank you, Mark.
That have that interest.
Julia is asking whether there is any benefit in using medical cannabis for Parkinson's with Lewy body dementia. We haven't touched on that aspect in particular yet.
Yeah, I mean, I think, again, I sort of touched on it briefly, just when we're talking about Parkinson's with dementia, cognitive impairment. I think that, again, there's all sorts of things that happen to people with Lewy body disease that, they may be interested there. Obviously, quite a lot of, these patients often, have behavioural disorders, for example, which we talked about a little bit. Again, it's a question of just of kind of caution, and just being really sort of careful about the potential for adverse consequences. I've certainly seen a small number of people that have come through our clinic that I've seen with Lewy body disease, though often with quite sort of prominent motor, symptoms which is why I think they've come to us. So yeah, again, it's not a contraindication, but it would certainly be something that one would approach with caution.
Thank you very much, Mark. Charles is asking if each batch of your product is tested for heavy metals and pesticides. I'm not mentioning microplastics, but it might be worth maybe widening the scope of how do you control the quality of your ingredients, so to speak, against pesticides, heavy metals, and other nasties?
Yes, so everything on a batch by batch basis will be tested for heavy metals, pesticides, obviously the content of the CBD and the THC within it, as well as heavy metals as well. So yes, everything is tested on a batch to batch basis.
Thank you very much, Simon. Look, I think we were going to run out of time. I see we have answered 34 questions, which is a very decent number. We have 14 questions open, so I do apologize for those people whose questions were not answered. If you really have a burning question that you can't live without, so to speak, send it to me by email, and I will be happy to pass it on to Simon and to Mark. So let me just say thank you to Beatrice, to Simon, and to Mark for a very stimulating session today. It has been wide-ranging. Hopefully it has improved everyone's understanding of medical cannabis and what it can help with, what it can't help, and what you should do if you want to access it. Remains to me to say that actually next month on the 8th of December, close to Christmas already, we will be welcoming Professor Roger Barker, who will be talking to us about stem cells and Parkinson's. How close are we? An interesting topic. For those of you who have been watching us for years, Roger Barker has already been on our channel. He's the Professor of Clinical Neuroscience at the University of Cambridge. So I'm looking forward to seeing you on the 8th of December. And again, thanks to Mark, Simon, and Beatrice for today. Thank you very much.
Thank you
Very much. Take care.